Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Morning, everyone, or afternoon.
Hello. Happy Q&A day. Just want to do a couple shout outs to some members. So Marianne started the program with 57 out of 132. And in 3 months, she was down to 3. So that is like a huge job in 3 tiny, very short months, all the way down to 3, which is absolutely amazing. And then we had who started the program at 55 and in 4 months was fully recovered. He had actually came on one of the Q&As a while ago. He was having some difficulty. He was kind of at a roadblock, and through some troubleshooting was able to figure out to go to his doctor, get some hormone testing. And within 2 weeks of starting supplements, he came back on and shared that he was feeling so much better and fully recovered at that point. So a huge shout out for him, and just goes to show like how quickly things can change with the right testing, the right provider, and having the right team in place for that. So sometimes we just need that little troubleshooting, and it kind of just unlocks all the answers for us, which is also why we love these Q&As. We can go to our first question.
My question is for Dr. Hrkal. I talked to you on the Q&A 4 weeks ago because I had issues with my stomach lining. We weren't sure if it was an ulcer or acid reflux, but something was wrong. And I wanted to ask you, now that 4 weeks has passed, when do you think it's a good time to return to the foods that I've been avoiding, and if there are any foods that I should avoid more long term? So to give you a quick summary of the past 4 weeks, I've been taking pantoprazole, 40 milligrams. First I took it twice a day for the first 2 weeks, and then once a day for 2 weeks. And for the next 2 weeks, I need to take it once every other day and then stop completely. And I took paracetamol for the pain for the first 1.5 weeks, and then I stopped, and I haven't taken it since. The head of my bed was raised for about 2 weeks and is now back to normal. I'm still eating and drinking the herbs you suggested, which were slippery elm and licorice and marshmallow. I don't have pain anymore. Most of the time I don't notice it anymore. Once in a while I feel uncomfortable in my solar plexus area, and that is mostly when I'm lying down. But it gets less and less frequent. But if I do push or touch the solar plexus area, I am sore. However, I don't know if it has to do with the stomach issues or just because there are so many nerves going through that area. So my questions were, when is the proper time to reintroduce the foods that I've been avoiding? I'm still avoiding stuff like tomatoes, apples, citrus fruits, onions, and strong and hot spices.
Mm-hmm.
Before this incident, I took apple cider vinegar every morning because it made the rest of my stomach or digestive system feel more optimal. But I wanted to ask if I should avoid it long term because I don't want this, whatever it was, to come back. And I also once in a while drank sparkling water just as a treat because I liked it, but it's not necessary. So I wanted to ask if I should avoid that more long term as well.
Right.
And up to this incident, I was eating a lot of lime juice and hot spices just because I like it, pretty much
Mm-hmm.
daily, I think. So I wanted to ask if I should reduce that as well. For the first 2 weeks, I avoided mild. I avoided spices completely, and then around 2 weeks ago, I reintroduced very mild spices, but nothing
Mm-hmm.
very hot or spicy.
Yeah. Okay. So that gives me, thank you for that very comprehensive review, first of all. That gives me a really good reminder of the conversation that we have. So I think things went according to plan. As of right now, we still don't really know why it was happening, but you followed, I think, your doctor's advice by using the proton pump inhibitor, which is the acid blocking medication. My general suggestion is that right now you're going through a weaning off process, and so you've done 2 day, now 1 a day, and then you're going to go every second day, and ultimately you want to discontinue it. Is that the plan that your doctor has for you?
Yes.
Okay. So while you're still doing that weaning off process, my suggestion is that you don't add any foods back, like the ones that you listed, which I know you enjoy, I know you like, but don't add them back right now until you've fully weaned off the proton pump inhibitor, because there's just too many other variables at this point as you are trying to reintroduce foods and decrease medication levels. You're not going to know which one's causing it, because sometimes as you get to a point where you might handle 1 a day with very minimal symptoms. Also remember, healing is also happening all along this time. You can still feel little sensitivity, so I would wait to reintroduce the foods after you've weaned off the medication, just to reduce the extra unknowns.
Okay, I will do that. How long after do you think I should wait?
Well, I would say if you weaned off and you feel good and you're asymptomatic, then you can start introducing some of the foods, but maybe do it one at a time. So, like, for example, apple cider vinegar 1 day, the next day, more lime and kind of lemon. The next day, adding a little bit of spice, like cayenne pepper, and then increasing the amount there. So, I would just really focus on not doing it excessively all at once after you're able to get off the medication and after you've done the weaning process.
Okay, I will do that. The mild spices I've been using, is that okay, or should I cut back on those?
It sounds like you tolerate it okay. I think whatever you're doing right now seems to be working for you. So just stay the course and just kind of do what I just described there.
Okay, one last thing. I've been avoiding onions because I don't know, they just seem spicy, but I don't think you actually mentioned them. Are they okay to eat, or should I avoid them?
Onions and garlic, particularly garlic, I would say, are pretty common uh, aggravators of upper digestive symptoms. Now, I would say hot spiciness and alcohol and sugar are worse aggravators, and of course acid. So I would, especially if you're cooking with them, it really deactivates a lot of the more kind of caustic elements of those herbs. So I would say that they could probably be, especially something in like a saute or a soup, it's very minimal in terms of the aggravation.
Okay, so I can eat them in small amounts now?
Yeah, I think that would be a reasonable thing to do.
Okay, thank you so much.
You're welcome. I'm glad you're feeling better.
I do. Much better.
Wonderful. Okay, so we're going to go to the next question.
Hello. Well, I tried to ask my question last week, but I think you were on vacation. So it's also posted online. But basically I was told I should try and follow up with you about basically like sun and heat sensitivity has been an issue. And so I think part of what I'd asked online is, it had been suggested that, maybe just more mindfulness. And so my question is it just that component? Is there more to it in terms of like, I can feel like my body's shutting down if there's too much heat or sunlight. Like I used to work outside, so I'm not afraid of the sun or the heat. It's just all of a sudden I can't tolerate it.
Remember you shared with us that you were taking Benadryl, is that right? And we wondered about a histamine question.
Yeah.
Hrkal.
Yeah, Benadryl and Allegra.
And that's helping with this heat sensitivity?
Yep.
Okay. Does it make it go away totally?
Nope.
Okay. So all this heat sensitivity started happening after you sustained a concussion?
Yes.
Right. So I'm just asking some of the background question because I wasn't there obviously when you initially asked it.
Okay.
So it is possible that people can have a higher, I guess, a less of a tolerance to stressors, and heat is a stressor, even though pre-concussion you were totally fine with it. Other symptoms that might suggest it's a histamine issue is that you get feelings of flushed and redness, which often is associated with kind of heat in some people. That's usually manifested as a skin redness and a feeling like you've maybe experienced before where you kind of feel flushed. Any of those happening?
Not turning red as far as I know. It's more like there's a risk of passing out. So the concern kind of goes straight to like, all right, let's get me indoors to climate controlled space, or like having like numerous ice packs with me. Like a restaurant, their AC wasn't working that well. So like my ice pack melted. So they got me like a huge bag of ice and I just had to like keep moving it around and keep my body like temperate.
Okay. To be honest, this is not a common post-concussion symptom I see often.
I've heard that from my end of doctors too. They're like, what?
Yeah, it's not really a common thing. But I will say overall, whether it's heat or whether it's cold or whether it's noise, it's a sense that a sensation the body has to interpret. So I do think that is an additional stressor, let's call it. For whatever reason, it seems like the temperature piece is the aspect that's affecting you. There are areas of the central nervous system in the brain that regulate temperature, and for some people, the hit to the head and hit to the neck, and then the processing issues that occur affect eyes. Some people affect the autonomic nervous system. Maybe it's affecting your system that regulates heat. So something to think about. My suggestion is to continue to work through the program, to seek out whatever sort of care when it comes to histamine that you can find. A naturopathic doctor can help assess this histamine intolerance. Your family doctor may also look down that line. There are certain markers in your blood chemistry like eosinophils, which might be elevated. You can also measure histamine, and this is maybe another clue that a primary care provider can try to glean from your blood work to see if that's what's actually happening. But I find in general, most medical professionals are not really well versed in this type of symptom. And so like you've already experienced, they're like, I don't really know what's going on, but maybe try the histamine angle, try to get that assessed. If allergy medication seems to be helping with you, it's not a common symptom, but like I said before, it can be one of the things that is off for you, and still working through the general concussion rehabilitation is going to ultimately help with this. And the autonomic nervous system rehab through exercise and diet and mindfulness plays a key role in that feeling I'm going to pass out. because that's the autonomic nervous system when it's under stress, and in this case heat. It's obviously overwhelmed, and it starts changing blood dynamics, and you feel like you're actually going to lose consciousness.
And then, if you've ruled out everything as regard to, something that can be identifiable, you can also think about the stress response as being part of anxiety and panic. So oftentimes if we start to panic, if we're overheated or we're too cold, typically more if you're overheated, that's going to lead to that sympathetic activation. It's going to make us feel faint. There's all sorts of sort of symptoms that can align with feeling overheated that can be more related to anxiety and panic, particularly on the panic end of the spectrum. An interesting example we can think of is there's a rare disease called Fabry disease, and they're unable to sweat. So one of the things that they learn is that they need to make sure their nervous system is calm when they're in hot environments so that they don't have an overreaction to not being able to naturally reduce their body's heat. So something to think about, because there is a close link there between moving into anxiety and panic when we feel overheated and feel helpless, right? Like we're unable to do something to support ourselves. We're likely going to just move right into that nervous system hyperarousal. Of course, fainting is what happens when our nervous system is activated for too long, and then you shift into like a low arousal or like a hypoarousal state, which is the faint response, which is a parasympathetic response. So it might be for now, until maybe your medical team is able to pinpoint something else, can you focus on your breath work, grounding, reminding yourself that you're safe, even though you feel that at risk of overheating or feeling like you might faint. In a psychotherapy experience, in one-on-one therapy, oftentimes people will work with individuals to say, okay, so what's the worst case scenario if you faint? You faint. And then you kind of have to move on, and it's okay. So it's sort of rebuilding this confidence that even if your worst case scenario happens, you're still going to be okay. Of course, in the case of Fabry disease, that's a bit different. But when we're thinking about just a natural sense of overheating without medical cause, I think you could work a little bit with therapeutic techniques to help build confidence that even if you feel that way, you're still safe. So getting a healthcare provider or a psychology provider can be really helpful to build up strategies as well.
Thank you.
Yeah, I was going to kind of add to that is that, and as soon as you've had like a previous experience of this type of situation where you felt faint, it almost becomes an expectation that anytime you're in heat, you start going, oh no, this might happen again, which then increases anxiety, right? Like the blood flow in our brain is controlled by our autonomic nervous system, which is fight or flight or rest and digest, right? One or the other. And you need that good balance in order to regulate blood flow to the brain. The reason why people faint is that blood is not getting to your brain. So it's your body's safety mechanism. By putting your head down on the ground and your whole body on the ground, it puts your head at the level of your heart and just allows blood to naturally gravitate into your brain. So it's a safety mechanism that says, I'm not getting enough blood right now, I'm going down to try and get more blood to my brain. And that's why we faint. Well, why is the blood leaving our brain when we're hot? Well, when you're hot, your blood vessels dilate to try and cool your body down. It dilates all your blood vessels at the surface. But then if we start to feel anxious about that, our sympathetic response also dilates blood vessels to our muscles. Because our sympathetic response is our fight or flight, right? We need to run away from the bear that's chasing us. So therefore, we need more blood to our muscles. But if you're just sitting stationary and you start getting all this blood dilating into your muscles, the blood is then draining from your head. So then you're going to feel faint. So this is kind of getting back to that anxiety response. Is like if you've had this experience in the past, if you start creating this expectation of it happening in the future, as soon as you start to feel hot, now you're going to start to go, oh no, it's happening again. And then now sympathetic response, which dilates things further and makes it worse. And now it brings it on, right? So I think what Melinda's saying here is accurate. It's like, yes, okay, let's get some checks. Let's rule out some stuff. Let's maybe see a naturopathic doctor. Let's get some blood work done. Let's look at, histamine response. Let's see if there's something going on there. But on the flip side of that, I think also it's, you know, helping ourselves to kind of expose to the situation. Like, I almost think, like, maybe going and starting to get into a sauna every once in a while and just, like, in small incremental bits to slowly, like, let yourself, kind of acclimatize to heat exposure in a way. It also will then give you the confidence that, okay, I've done this before, like, I can tolerate higher heats for longer periods of time, which then allow you to kind of live a life that, gives you a little bit more freedom and the ability to kind of do, more stuff. Um, that's kind of where I'm going with this. Like, I think it's kind of an autonomic response, just the way I'm hearing this. And autonomic is so predicated on, anxiety. And so it's kind of this twofold situation where, we've had probably a few negative experiences in the past, and then that can almost start to bring it on because it kind of becomes something that we expect, and we kind of get worried about it ahead of time even. And, yeah,
It's like
anyway.
it's another autonomic stressor, Cam. Like
Yeah,
that's the
yeah,
way I look at it. So like for some people it's noise, some people it's light, some people it's
right.
exercise. It's all
Yeah,
changing blood flow dynamics and the way the nervous system controls blood flow.
right.
So for whatever reason, you happen to have a sensitivity to heat. It's not unheard of. You're seeing it even in the comments. I've seen a number of patients saying, "I'm just intolerant to any sort of extra stressor," so they feel worse in the summer when it's hot and sweaty and muggy. Uh, I think it's a good idea to think about it in a way that, okay, now I need to avoid it like crazy. I need to like kind of like exercise. If you have exercise intolerance, think of the same thing with heat intolerance. I need to actually build up my resilience a little bit to challenge my autonomic nervous system a bit more.
And when you're looking at exposures, it's always recommended to do that with a mental health professional, right? Sometimes there's something called flooding, which can create more fear, and we don't
Mm.
want that. So when you're working with a mental health professional, they can help build a guided exposure, which is a graduated exposure to feared stimuli, and that's going to be most helpful. It can also help. In the therapeutic dynamic to work with someone that's going to help build your confidence. When you just kind of try it on your own, oftentimes, you can get easily overwhelmed, right? Create more fear. Going into a sauna when your fear is already an 8 out of 10 might put you at like a 12 out of 10 and you'll never do it again. So it might be like finding a way to, work with someone to build a plan where, a sauna might be your graduation exposure where you're looking at really, challenging yourself. And I've had some comments, or I see some comments here in the chat box around um, like the fear of falling post-concussion when it comes to fainting, which I think is a really, common fear and makes a lot of sense. And, psychotherapists and psychologists, counselors can really help you build up skills on how to make sure you're safe, right? So if you think you might be at risk of fainting, okay, let's sit down. Let's make sure we're somewhere where it's going to be low impact or low risk of falling and injuring yourself. There's all sorts of techniques that you can work through to help support and build that safety back into the body and the nervous system to help you get through this. And it doesn't mean give up on what's the underlying cause of why this is happening. There could be, right? I know histamine is a big thing, and Dr. Paul's already talked about that. But in the interim, instead of having it escalate and the fear becoming greater and greater, it can be helpful to get some support.
Okay. All right. I'm hearing a number of pieces of advice here, and probably gonna need to find a way to get some of this info back a little bit summarized. Um, I, to be quite honest, the mental health piece, I mean, like I understand it. I'm pretty good about I'm the person who tends to push through until way past the point I should have stopped. Um, so like in terms of having fear of it, it's more like it just kind of pops up suddenly. It's like, oh, lovely. Well, we better stop before before somebody decides to call 911 because I am passed out on the floor.
Mm.
So, it's more trying to figure out how to like combat it, how to not just the mental health piece, but how to deal with the rest. So how can I get this kind of summarized?
Well, this is a recording, so you can go back and take a listen. If Nikki has a moment, she can maybe put some bullet points in the chat for you. And far as sort of like pushing through, that's also something that a therapist can help you work with, because they can help you to start recognizing early signs of distress in your nervous system before it gets to that point of, oh no, now I'm going to faint and I don't have any warning. There's also some medical professionals that do help with that as well. I know occupational therapists are great at that to help support you. Um, there's autonomic nervous system clinics that help kind of strategize for people that have a tendency to faint easily, to help support you to figure out ways to work with your nervous system where it's at and build some awareness so that you're not just suddenly fainting, right, like you described. So those might be some avenues to explore as well in your geographical area. I'm only really familiar with the GTA. I don't know if you're in the GTA.
No, I'm in USA.
Yeah.
Okay. Thank you.
I'll summarize in 15 seconds here for the benefit. Okay. And I
Thank you.
suggest go back and listen. I know we threw a lot at you, but ultimately it sounds like, here's the takeaways. Number one is if histamine blockers, antihistamines are working, then that's an angle to consider with your primary care provider. Can we get more testing? Go and ask, can I test my allergy levels? Can I test my histamine levels? If they've already tried that, then you say, is there a specialist I can be referred to? That's number one. The main takeaway from what we think is probably going on is that your nervous system, your autonomic nervous system, is causing this issue. And so just like exercise intolerance and just like being overwhelmed by stressor of any type, heat is a stressor. And so working on the autonomic nervous system is paramount. And exercise, even though it's going to heat your body up, diet, exercise, and mindfulness all are going to be part of that rehab program.
Okay.
Does that make sense?
Yes.
Okay, good. So start with that.
No, I'm trying the exercise thing. I just have to do it incrementally because, do it for a minute and make sure I don't get too high. But yeah, no, I've been paying attention to the buffalo thing and taking that into account.
Exactly. And that's we would have the same advice for anybody with any intolerance as part of the program. So you have to kind of go through it very gradually, and you have this additional heat piece, right? So it's just another symptom that is going to be part of your rehabilitation process. But the pathway, applying all the things that we talk about it in the Concussion Fix program, are still absolutely important. Okay?
Okay. Thank you.
All right.
Appreciate it.
You're welcome.
And I would add just the vagus nerve stimulation stuff.
Okay.
Right, like some of the breathing exercises and that type of stuff, just to help increase the balance of the autonomic system. Because sometimes if you're not at the point of being able to exercise yet, starting with just the vagus nerve stimulation stuff is your first step.
Okay.
Right, so that stuff's covered in Dr. Hrkal's module. But even from an exposure perspective, it's like, if you could get like a lounger where you're not sitting upright and you can just kind of sit in, a warmer environment, just to start acclimatizing your body to that, just doing that regular exposure, but also kind of breathing through when that sensation comes on, trying to use some of those skills to kind of breathe through it and kind of sit with that discomfort a little bit. And you're in a safe environment because you're lounging. Like even if you did faint, you're not going to fall or hit yourself or anything like that. But you're in a safe environment, right? You have people around you that could help if anything went wrong, and you're not out at a restaurant, but you're just gradually increasing your tolerance so that eventually you can go out to restaurants because you know that you can tolerate it for longer. So, kind of building up in a safe way, I think is another piece I would add.
Okay. I'll be working on these things.
Okay.
Thank you.
Okay, next up is...
Thank you. Good to see you all.
Hello.
Got one question for Paul, one question for Cam. Question for Paul. We already talked about this, but I went with the pill for testosterone and clomiphene. I don't know if you've heard of that.
Yep.
And my question to you is, would the pill make significant improvement on mood, depression, ability to heal, or do I need to go to the injection? What do you see? And then the other question is, what peptides do you recommend?
So I can answer the peptide one really easily. In Canada, peptides are illegal. Can't use them. So I don't really have any clinical experience with them. So it really is your local doc in the US that will give you some insight on peptides. Um, in terms of the testosterone, when you're saying orally, are you taking testosterone or are you taking something like Clomid orally?
Yeah, it's in clomiphene, I think it's called.
Yeah.
50 milligram.
Because testosterone is not done orally, it's done by injection. It really comes down to, like, to answer the question directly, it comes down to what your values are doing. So it's kind of like, all right, so whoever's prescribing this, they have your initial value, they prescribe something, whether it's something like the Clomid or whether it's actual testosterone, and then they recheck their values, and they're also checking how do you feel. So those are the two things that are gonna gauge. And so initially, if you've done this oral medication, then if you after the next follow up, what 6 weeks, 8 weeks, whatever it is, no improvement, go with the injection or the cream when it comes to testosterone, and do the same thing. So there, with any medication, especially when there's deficient levels found, you're always double checking with objective values and then also subjective values, making sure that things are moving in the right direction. So I think that's the process you have to be looking for.
Great. And then for a functional doctor recommended, they help with their bread and butter is HP Axis, which is autonomy, I assume, fatigue and sleep. What should I expect from a good one here in the States? Anything TBI specific? I need that they wouldn't know. And then do they work with growth hormone? Because on your slide, you say that's another important thing.
Sorry, so what question are you asking?
I'm meeting with this functional doctor and I'm spending a lot of money. I just want to make sure I get the most out of it. Will he be familiar with TBI, growth hormone, and HP Axis?
I'm not sure. I don't know this functional medicine doctor. Usually they should, because HP Axis is a core piece of what functional medicine does. So I hope they do, but I can't guarantee that.
Okay. All right. Thank you. And then for anybody,
sorry, before you go on that one, I think the thing to consider is that we're always concerned about, the TBI part of it. But remember, concussion and PCS are not related to ongoing brain injury. They're dysfunction in other systems. So a functional medicine doctor will be able to look at all your systems and help you to get them regulated. And that might include growth hormone if it's low. That might include testosterone if it's low. That might include other, modalities to try and get things into balance. So I wouldn't be too concerned about the TBI perspective. I would just think that that's potentially one element that could be driving your symptoms. And if they specialize in that one element, then they'll be able to help you regulate that element. And that's really what you're looking for, okay? So don't get too hung up on the TBI or not. It's like
my phone froze. I don't know if y'all could hear me. 20 seconds ago it froze, so I didn't hear the last part, but
all I'm saying is that I don't think we have to be as concerned about the TBI perspective, right? They don't necessarily have to have expertise in that, but persistent symptoms from concussion are due to dysfunction in all these different systems. One of those is HPA. And so if they're proficient in HPA, they'll help you to regulate that system. Regardless of their TBI knowledge or experience, really what you're looking for is, okay, are my hormones in good balance? Is my HPA in good balance?
Gotcha. Thank you very much. I appreciate it. And then the last question is, I'm doing good on neck. Want to see a vestibular work with PT, and then finish with neurofeedback, and just seeing what your thoughts on that, specifically like PT. Do I just see a normal PT?
Well, really, when it comes to neck, the way that I think it should be structured is manual therapy, followed by proprioceptive rehab, then followed by strengthening and stabilization rehab. So a lot of PTs will jump right into stabilization exercises, and that generally can work, but it'll take months to get there. So manual therapy is much more effective. So if you find a PT that does manual therapy, great. But you may need to find somebody else, like a chiropractor or somebody. If you go to my manual therapy lectures, so I did a 2-part series in the resources. If you go to my resources and look up manual therapy part 1 and part 2, that's all about neck dysfunction. If you watch that, you'll have a really strong understanding of what you're looking for with regards to neck function and treatment.
Great. And what about vestibular for getting a PT with like the balance and dizzy and things like that?
Yeah, it depends on what's driving the dizziness, right? Because dizziness could be coming from the neck too. So that's why, like, if you look at kind of how we like to structure things, generally I put neck before visual and vestibular, because if you fix the neck, oftentimes the visual problems and vestibular problems go away.
Yeah, and that's going to happen with this, because I told you I'm going to that NUCA doctor down in Fort Myers this week, but I'm just planning for the future in case I can't get into another session with vestibular. If it doesn't all clear up with the neck, do I just go to a normal PT here in town that my doctor recommends, and
I
they
would
can
find a
work?
vestibular, if it's vestibular, right? If you do the neck work, right, and one session probably won't fix it. Like, you probably need a bunch of sessions to know whether or not your neck is involved. And if that doesn't clear it up, then what I'd be looking for is potentially a vestibular PT.
Vestibular PT. Where do you find those? Just you look them up online?
Yeah, I think if you just Google vestibular PT in, your area, you'd be able to find clinics that specialize in dizziness and balance issues.
Nice. And then as far as a PT, you just look at them as for the neck. They do the stuff on the neck.
Yeah, I mean, everyone's got different kind of skill sets, right? Like, PT is one of those things where some people specialize in, autonomic function, some specialize in vestibular, some specialize in neuro rehab, some specialize in musculoskeletal. So it really depends on what the issue is, and that's kind of the tricky part. If it's a neck issue, then you probably want to find a good MSK PT, like a good like a sports PT or a musculoskeletal PT. If it's vestibular, then you want to find a vestibular PT. So it just depends on kind of what the issue is.
Gotcha. Great. I really appreciate it. Thank you, guys.
You're welcome. So Nikki, with here, we've been chatting. Can we just get him live?
Yep. If you want to unmute yourself.
Hey Cam. Hey Paul.
Hey, how are you doing?
Good. Yeah, no, I saw your chat privately, but I just thought I'd jump on the session. So yeah, Dr. Sean, is working on the neck. I think we've focused a lot on ART, and I've had ART from a bunch of different places, Cairo, other things, but it doesn't seem to be getting, I guess, to the root of the issue. And my condition is, or my situation is a little unique in the sense that, like, my last concussion was in 2012, and I, for the most part, was functioning very well with minor PCS, I would say, and then I had a bit of a neck issue, or like a sleeping injury, I like to call it, where I really jammed up my neck, and it seems like it's local to the the SCM, the suboccipitals. I don't seem to be getting like the relief that I need, and like I have a lot of vestibular type symptoms, balance, brain fog, low energy, but my vision specifically is really impacted. Previously I could go, like I told you, I think I could go play hockey. I could go, to CrossFit, take my glasses off, all good. Now I effectively feel like I'm gonna, fall over if I take my glasses off, and the accommodative dysfunction within my right eye which is the side that I seem to have injured, is effectively gone. Like I can't really accommodate any focus with the right eye. left eye seems fine though. Anyways, so yeah, I mean, Dr. Sutton is doing some manual therapy. I didn't experience, I would say, as big of a spike in symptoms after the last time, but I've never really experienced like in the manual therapy. You say, okay, well, I'm feeling good for a few days, and then you whatever. I don't feel good ever, if that makes sense.
Are you having headaches too, or no? Just the vision?
No, never headaches. Never headaches. I mean, I do have like I would say like my eye hurts, like in and around I think you call it like the ridge or whatever. There's a
Like up
nerve
here?
up there. Yeah, right there.
Yeah.
And like I almost, it sounds weird, but I almost feel like my ciliary muscles hurt sometimes. Like at the end of the day, like my eye ball physically hurts.
Yeah.
But so I mean everything makes sense. Like I read I'm an engineer by profession. I'm very I'm a problem solver. So I've chat GPT'd the crap out of this, done all the modules. So I know that what I'm experiencing is possible. I'm just trying to solve it.
Right. And have you gone? I know you were talking about Shirley Blanc. Have you gone to Shirley?
No, I've done vestibular. I've done vision therapy through Neurovision, which is a clinic in Whitby, and I think that the neck held me back.
Right.
So I have all that vision therapy stuff. I spent the money on it. I'm open to doing it again. I just don't really want to continue if I'm not seeing the results, right? So.
Yeah, of course. Okay, so I mean, Sean's only done a couple treatments on you, so I would say just keep working with that,
Okay.
and see what it yields.
Yeah, I mean, he does have. So I'm doing the exercise, and I don't seem to struggle too much. Like I could run. I had no issues with the Buffalo test. Like, I'm free to do whatever I want. I'm doing the zone 2 training. And that's fine. I do feel a little dizzy afterwards, but I don't know if that's necessarily, lack of fitness or, or, the concussion.
Yeah.
Not super worried about that. But yeah, I don't know if there was something I should ask about with Dr. Sutton. Like I haven't done any of the sort of acupuncture stim stuff. It's pretty much just been, the thumb therapy, like manual, getting your hands on the neck kind of thing.
Yeah. Has he done any adjustments on your neck?
No. But like when I'm in and around the SCM and into the suboccipitals and things, like it fires off into my eye. Like it.
Right. There you go.
So I'm like, okay, cause and effect.
Now, when he treats you, is he able to fire that off into your eye?
Oh yeah.
Okay, good. Yeah. So that means he's pushing hard enough, which is good. I mean, he's a good therapist. I think you're in good hands there. I think you might just need a few more sessions to start seeing some benefit. And if you're not, then I would recommend, maybe even just getting an assessment from Shirley and seeing what she thinks.
Sure.
Because a lot of vision therapists, with the exception of Shirley, they don't really understand the connection between the eyes and the neck. But
no, mine didn't.
But her whole thing, her whole thesis, like when she did her like neurooptometric fellowship, her whole thesis project was on the relationship of neck function and eye function. So she's very, very up on this, and she'd be able to kind of give you a good insight to say, okay, I think, and maybe it's vision and neck combined, like maybe combining those two with Dr. Sutton and maybe Dr. Blanc would help. And I see your other comment here about a reasonable schedule for implementing the elements, right? Like there's a lot to do.
Yeah, I got a 1-year-old and a 3-year-old, and to be honest, like I'll never give up on this because they mean the world to me. So I need to get better for them.
Yeah. Yeah, but it is hard to like juggle all this stuff, right? So
yeah, I like to say I'm high functioning PCS, like but it's like not sustainable. Like I feel like I need to get a solution because I'm killing myself here.
Right.
Like
right. So Okay, so I would say from the eye perspective and the neck perspective, I would say work with Sean for another 4 weeks.
Yeah.
And if you're still like something's going on with this eye, then I would say try to get in to see Shirley for an assessment, get to see what her thoughts are, and then maybe it's a combination therapy between the two. Now, in terms of like implementing the other stuff with young kids, I mean, that's a challenge, obviously, but it's like a lot of the things are okay, dealing with kind of the mental health side of things, right? So it's finding some time to be able to, maybe do some meditation for 10 minutes a day, going for a walk to get some exercise and
Yeah.
then eating healthy. Right. So if you get your whole family kind of eating the Concussion Fix diet, then it's easy. It's nothing really to implement.
Yeah.
Other than that, you need basically a good maybe hour to yourself per day to like, if you wake up in the morning, if you can get, 5-10 minutes to do some meditation early, and then, maybe after work you go for a walk and get your exercise in. That's really kind of that's kind of the meat and potatoes, and then make sure you're prioritizing sleep. I know it's hard with young kids, but making sure you're going to bed at the same time and doing all the sleep hygiene stuff, like, no screens before bed and all that stuff, and getting early morning sunlight is important as well. And then other than that, it's just kind of your rehab appointments that you'll need to schedule in. But
Let me
those are the basics.
Let me add a couple things there too, because I know with people that kind of have this like push mentality, and it makes sense, right? You've got a young family to take care of, you've got a lot on your plate, you want to be able to keep going. I often invite people to do like a need to have and a nice to have list. Oftentimes, once you write it out, people will find that they have a lot of need to haves in their list that are actually nice to haves. So I always recommend when someone's going through something like this, but you're still high functioning, you're still trying to keep up with everything, write out your list. What are the things you can actually cut out before you start trying to add in more self-care? Sometimes when you try to add in more self-care, you're actually burning the candle at both ends. So my recommendation is more simplify first, get up to a baseline where you actually have breathing room, even though you have young kids at home, it is possible. Because right now I'm hearing there is no breathing room. Am I hearing that right?
Yeah, not really. No.
Yeah, and that's a recipe for burnout, right? So you want to make sure that you're as much as you're hustling it to try to find these answers to PCS, you do not want to go forward with jamming your schedule full of even self-care activities plus everything you're doing, because you're burning the candle at both ends, right? It's too much. So I always invite, if someone like you were to walk into my office, I'd invite a pause and I'd say, let's write a need to have and a nice to have, because I can guarantee there's going to be things in that need to have list that can wait. Another idea is to pace out the amount of things you're doing with your PCS, right? One at a time. Take a couple months to do one, take a couple months to do the next one. It doesn't all have to be at once. That doesn't not always a recipe for success. It's actually still a recipe for burnout. And I work with burnout a lot in my practice. And what I constantly see is people who have that kind of pushing mentality. They're just going like, I've got to solve this. I have to keep going. You've got your why, right? You've got your kids. You want to get there. But pacing yourself is likely to be more effective than trying to do it all right now. Especially if you're already functioning enough to keep working and to keep doing things, then there's no need for this urgency to do everything right now. So seeing whether or not you can like choose, a loose kind of rule I use with clients is the rule of three. Choose 3 things you're doing to support your PCS right now. That's it. Leave that for 3 months. Then choose 3 more things or mix it up. But it doesn't have to be this race to the finish line. It's more that like it's the journey, not the destination when it comes to working through these things so that you don't reach a state of burnout, which then is going to be a PCS flare and setback. And, it sounds like that's not something that's, fits into your life either. So it's sort of like finding balance. And maybe those 3 things are sort of what's Cam suggesting. Can you carve out 10 minutes to get outside in the morning when your kids are occupied and get your feet in the grass, or take some breaths, or do a mindful pause, or, what are the things, the self-care things that really resonate for you? Thinking about.
Yeah, I'm really enjoying that Sam Harris waking up. Like,
Great.
Yeah.
Yeah.
So, like, if you were to do that, like, so if you just think about these, like, let's say 3 things, right? Like, okay, if you do the Sam Harris app for 10 minutes, in the day, maybe in the morning, right? Like if your spouse can take care of the kids for 10 minutes while you do your meditation, great. and then you're just focusing on you get the whole family kind of eating the Concussion Fix diet. Therefore, the foods you're eating are that, right? And then after you go to work, you do 20 to 30 minutes of exercise. You go out for a nice zone 2 walk. That's it. Those are the basics. And that over time, just being consistent on those things is going to basically help you kind of establish and maintain that foundation. And then other than that, it's, the appointments you may need. But right now you only have one, right? Just deal with Sutton for now. And that's it, right? Maybe once a week you go to Sutton. But other than that, it's like your daily routine is simple, just meditation early in the morning and then go to work and then a little bit of exercise after work. But other than that, it's just try to make sure your meals are healthy throughout. And that's it. That's it. That's the entire essence of the Concussion Fix program. Is, you have some mental health that you find that's helpful for you, which I think meditation is probably your best bang for your buck if you're able to do it. And then just a little bit of light exercise and, getting a good night.
Does it make sense that I can't get into zone 2 by just walking, so I have to do the bike or something?
Yeah, that's okay.
Okay.
Yeah.
But it sounds like, as you know, I know your case really well, and I sent you to Dr. Sutton. So, it sounds like the major limiting factor is like, if your neck is causing this, then that's the main area of your focus. Because we've done a lot of the other things that could possibly be holding you back, and you check a lot of those boxes. So, like to the point that you were making about doing all the things that you've done are not the things that are holding you back so far. The thing that's holding you back is what we just talked about here. So, Dr. Blanc would be great, and then just get maybe more frequent with Dr. Sutton to really see if we can get into the areas to make progress there.
Yeah, some comedic relief for the group. When I did the testing, my testosterone came back high or higher than normal, and I came back and told my wife, I'm really manly. And she did not laugh at that. I was like, oh, you really have a man right here. And, she was like, no one's ever said that about you in your life. So, anyways, I thought that was funny. So, thanks, guys.
Nikki, do you want to read this one member question here at the top?
Yep. So the question is, I am told I have high cholesterol and high blood pressure. I'm already following the diet and have been for a long time, as I can't eat gluten for the last 15 years. I can't take a lot of medication as I can't tolerate sulfites, which most have. I'm hoping to see my naturopath soon, but can't see her for a few weeks. Any herbs that you recommend to help start? And I have heard that cholesterol can be good. We need it, but to a point.
Yeah, I don't think anything you can do in the span of a couple of weeks that I can recommend is going to really make a difference on this. Like blood pressure, if it's elevated, that's where medications come in, and supplements and things like that, like magnesium, are some of my favorites. So again, CoQ10, magnesium are two of the core things for blood pressure. But there's honestly not a lot of herbs that help with cholesterol. There are some herbs that help with blood pressure, but again, not really effective. So the core things that we talk about in the Concussion Fix program, with namely being magnesium, and then just wait till you speak to your ND to get some more personalized advice.
Great. And it's a great spot to wrap up this week's Q&A. Thank you everyone for coming on, and I hope you have a great day. Bye.
Bye-bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit. And don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.